Hello, everyone. I hope everyone is doing okay today. My name is Hannah, and I'm going to be hosting this session for today. Dr. Chance, whenever you're ready, the floor is yours.
Thank you, Hannah. Again, my name is Dr. Chance. I'm really excited to talk with you this evening. Thank you all. Thank you, Fresh Dental Shadowing, for having me here. I'm so impressed with what you have going on. This is phenomenal, and a phenomenal way to introduce a lot of prospective dental students and colleagues to dentistry and to different people and different perspectives. So hope we have a great discussion, and let's get started. So this is me, Dr. Christopher Chance. I'm the owner of Oaks Point Pediatric Dentistry in Houston, Texas. I'll also talk a little bit about, I was working as an associate for a little while before owning my practice, and kind of talking about navigating through that and, have different options that you have after dental school. We'll talk a little bit about education, the institutions that help, shape who I am and shape what I do. Pediatric dentistry in general, and how important it is to, educate parents and kids, and even, to be honest, practitioners of the importance of good oral health for children. Talk a little bit about private practice. As I mentioned before, a little bit about owning an office, but also being an associate. And I also work in an outpatient surgery center. So I'll talk to you a little bit about that. There's different options here in regards to your dental profession and what you ultimately want to do. We'll talk about a typical day at the office, again, as an associate, as an owner, and also in the outpatient surgery center. And to me, why pediatric dentistry is so important. And then afterwards, question and answers. Okay, so I'm a proud graduate of the University of Kentucky College of Dentistry. I did also attend University of Kentucky for undergrad. I received a BS in agricultural biotechnology. One of the reasons why I chose that that major, was, I kind of thought if I wanted to go to dental school, I'll talk to you a little bit about why I wanted to go. But when I thought about that, I said, okay, what I really want to do with my application, with my personal statement, with whatever I have to submit, is just to separate myself. That's all I thought undergrad was for, necessarily, education-wise. So, I came across agricultural biotechnology. Goodness, haven't said that in a long time. I was a biology major for about 2 weeks. I came in because I thought that, in order to be a dentist, I was told you have to be a biology major, you have to major in chemistry or physics or something like that, which is all fine. But when I first entered UK, I looked in the College of Arts and Sciences, and I was in a room full of seemingly thousands of people wanting to be biology majors. And so, okay, if I'm trying to separate myself, maybe this isn't the first. This is what I thought the first start was. Let's try to find a different major. So into the College of Agriculture, I kind of found my home, and I loved it. And so, I chose UK for costs and proximity to family. That was the same reason why I chose UK for college of dentistry, to be honest with you. I knew that dentistry was going to be a, more kind of an expensive endeavor. And ultimately, being around my family kind of won everything over. I also, once graduating from the University of Kentucky, I went on to study pediatric dental residency at Case Western Reserve University in Cleveland, Ohio. And, loved every minute of it. And Dr. Ferretti, Gerald Ferretti at Case Medical Center, Rainbow Babies Children's Hospital. I couldn't be where I am without him. He's a phenomenal mentor, and really taught me, everything that I need to know in regards to pediatric dentistry. After graduating from Case Western Reserve University, I moved to Houston, Texas. And the main reason for the move is my wife's from Texas, and I learned early on you can't keep a Texan out of Texas for too long. So I moved from that cold environment in Cleveland, Ohio, to beautiful Houston, Texas. So pediatric dentistry, why I chose it. I chose pediatric dentistry. I think that decision started early on. I was in high school, and at that time, I didn't even know what I wanted to be, you know, what I wanted to do after college. And so I needed a special service requirement to graduate high school. Every high school student was required to have a certain amount of hours to service to graduate. And at the time, my dad, he's a dentist, but I never really knew what he did. He's an endodontist, but he taught at the University of Kentucky Dental School. And growing up, I always thought he was just a teacher. I mean, I'd never really seen him do any dental procedures. So when I needed a requirement, I just asked him for an idea. What can I do? And he said there was a Saturday morning dental clinic at the University of Kentucky that happens on every third Saturday, and they treat children for free. And it's a student-led, student-run opportunity. And so I went there, had no interest in dentistry at all. And when I went there one time, and it was a junior in high school, and I never missed a session until I graduated from dental school. Like, I absolutely loved it. And, it was very, very, integral and just kind of putting the seed in my head in regards to how important pediatric dentistry is. So a pediatric dentist is a specialist who treats children from infancy through adolescence. And what we do is we try to establish positive experiences at the dentist that will carry through adulthood. And in dental school, one of the situations that kind of cemented why I wanted to continue to pursue pediatric dentistry is that I went to school in Kentucky. And so Kentucky is one of the, one of the states that has the most edentulous people, the people without teeth. And so, that was challenging for me because, I'll never forget it. I had an 18-year-old come in, only had one cavity on his tooth. Came in and said, "Doc, I think I just, I need to take all my teeth out." And I look at him kind of perplexed. I was like, "Why would you take all your teeth out?" And he said, "Well, my mom's had them out, my dad's had them out, everyone in my family's had them out. And it's about time to get my dentures." It's just, it was a part of a line. And I was looking at that and I was kind of saying, like, we have to break that cycle at some point. And so I think starting at a young age is a perfect opportunity to try to help establish and instill confidence in children to pursue their dreams. Outside of just being healthy, is I get to reinforce positivity in children every single day. Like, I really don't think there's really much better, in my opinion. And some people will think that all we do is we wear funny glasses and have fun with kids and throw balls and give them toys and everything like that. Well, I mean, they're absolutely right, because we have a ball as pediatric dentists and working with kids. But a big part of it is also understanding that 60% of children experience caries or cavities by age 5, and by 17, 78% will have had cavities. And when you think about that and when you see those numbers, and it's like, oh my goodness, like the amount of disease that's present is just kind of astronomical, and it can affect kids in multiple ways. How many kids are being forced to stay in school and be in school, and they are having trouble learning? And some kids who are being sent to detention or being reprimanded for bad behavior, in some circumstances, and I've seen this personally, they just have a toothache and they have a hard time expressing their frustration, that no one seems to really understand why they're in pain. And so, pediatric dentistry is so important because to help establish the kind of health for years and years down the line, and to be able to make that establishment and to be able to make children enjoy the dentist, then it would make life so much easier for them as they get older, but also for other caregivers in the sense of general dentists and surgeons and endodontists and things like that, where these children grow up to be educated citizens that they can take on their own health and understand what's going on. So a little bit about private practice. Currently, my office, the Oaks Point Pediatric Dentistry, is in Houston, Texas, in the Garden Oaks, Oak Forest neighborhood. In deciding is the reason why I wanted to start opening my office is, I came into dental school wanting to open my office, wanting to have my own office. I always say I have kind of an issue with, not an issue, but ultimately I don't like people telling me what to do if I can help it. So I always wanted to be my own boss. But what kind of cemented that progression of getting it done is just knowing that, having a good support system, that was huge. When I was looking and finding locations, finding a location that I feel as though that, seemed to me was a no-brainer, was really helpful in really just kind of giving me the faith to understand that, like, wow, we can do this. I can do this. And there's so many resources, and use me. I would love to be a resource for you in any aspect of your dental career. But finding good resources and finding people who have done this before, and it will absolutely help, and helped me really feel confident that I really wanted to go ahead and do this. The faith was a huge part. Like, I'm a person that kind of wears faith on my sleeve, and I know there's certain times, especially in dental school, where I felt as though I shouldn't be here, right? This shouldn't have worked out in my favor, but it did. I remember it was boards. I was taking boards, and during that process, basically it's a huge test in order for you to really become able to finish dental school and become licensed. And I remember we had to do a crown. We had to take a plastic tooth, and we had to cut the tooth into the shape of a perfect preparation for a crown. And I remember, and to this day, I said, thank God. Like, I don't know how, it happened, but I looked at the tooth and I started the preparation, and I just nicked the tooth with my burr, with my handpiece, and I actually started cutting on the wrong tooth. I had just one little mark on the tooth. And I looked and I said, oh my goodness, like, I think I failed, just right then and there. And at the time, it was kind of a calming voice that just said, look, just keep going. And so I started on the right tooth this time, and I did, like, one of the best preps that I have done to that date. It was just kind of like I had nothing else left to lose. So I submitted it and ended up passing. And the person kind of came to me and said, I know what happened, but at the end of the day, what you ended up doing by persevering and going through what you wanted to do, I can see what you're doing, even though you ended up making a mistake. And so, that's kind of just something that I can hopefully leave with you all. Just keep going. Just keep going. I know that if something happened at one point that you thought, was the end of the world, or you thought that something was going to go wrong, and it just ended up going in your favor, and you say, look, I have nothing to lose. I'm just going to keep going. Just going to keep going. So that's one reason why I kind of decided to go ahead and open. And so private practice or corporate dentistry. So when I first moved to Houston, I worked at a corporate dental office. And basically corporations are where basically the office itself isn't completely owned by a dentist. Could be some firms or capital firms, sometimes some insurances own offices, but ultimately you're not necessarily working for an individual. And so I loved working for a corporation because I knew I ultimately wanted to open my own office, but I knew that dental school taught me how to be a good dentist. Basically taught me how to be a good associate. Dental school, you know, to me, I don't think they do a really good job of teaching you how to be an owner. And so I needed to learn how to do that. And the corporation and working with corporate offices allowed me to learn more so the business side and increase my speed and understand how I like to practice when I know really that my license is on the line. So, and at the time, the first office that I worked, I was opening the office. It was a brand new office, so I was basically starting it from scratch. So I felt as though this is a perfect opportunity to see the process of opening an office and how growth works, how interchanging of insurances, money works, things like that. And one thing that I would say was a really big learning curve was seeing my work come back to me. In dental school, you see a patient. At our school, we started seeing patients at the beginning of second year. And you may see that patient maybe a couple times before they're passed on to another student. But when you're seeing the same patient every 6 months or maybe even sooner, then you do a filling and you look back 6 months later and you're like, wow, there's a cavity under that filling, or that filling didn't look good as good as I thought I did. But those are the really, really important times in dentistry, is knowing where you failed so you understand how not to do that again, or how to make things better. Doing everything right, doing everything perfect, I think didn't necessarily work for me, because when something came across that wasn't ideal, at first it was kind of tough to say, wow, this is something I haven't seen before. And what does it look like if this doesn't go right? And what it looked like is basically the biggest thing is managing expectations. It's not the fact that I did some work on a tooth and it may have failed. It's more so explaining to, and as a pediatric dentist, this is really important, explaining to the parent why or how and what to do next. In pediatric dentistry, the biggest thing to manage, other than maybe a wiggly kid, is the expectations of a parent. And I think that if you ask any pediatric dentist, we love working with the kids, because the parents is a little tougher. Adults, I don't know. And in dental school, that was one of the reasons why I went with pediatrics as well, is that, I can definitely forgive a child for being scared. I can work with the child being scared. A 4-year-old, I can help convince a 4-year-old to, basically put a needle in their mouth and then start working on them and then be happy about it. That's not as hard as convincing a 40-year-old who has had dental trauma in their past and who hasn't been to the dentist in 15 years, to look beyond their circumstances. That's very difficult. And so anyway, that's another reason why I went to pediatric dentistry. So I also worked at private offices as well. So as an associate for an office that was owned by an actual dentist. That was really awesome, because you learn different techniques in regards to, having a mentor there. Then also different marketing strategies, being an integral part of that community, having someone who has seen a child so long that that child's children is seeing them. That was big. That was huge for me. And so those experiences are very important as well. Now, I currently work at these corporate offices while I'm opening my office. The office has been open since September 26th of 2020. Now, it was definitely not my intention to open during the middle of the pandemic, but it's part of that faith thing. And our neighborhood has been awesome. It's been phenomenal with receiving us. And so in part of opening an office is because loans are so much, because the cost of education of becoming a dentist is so high. Um, it's different than what it was maybe 20, 30 years ago. You're graduated, you may open an office, hang a shingle, maybe put your name in the yellow pages, and people kind of start coming to you. It requires a lot more capital, requires a lot more money to, get in front of people. What's helpful is social media, because that's free. That's very, very helpful. But other aspects of it is things become pretty expensive. So working at other offices, continuing to work as an associate, has also helped me help the aspect of opening an office during a pandemic. So a couple important factors when applying or accepting jobs once you're out of dental school, once you're out of residency, if you so choose, is one, as I mentioned before, mentorship. When I first moved here and worked at the corporate office, the doctor that I worked for was a general dentist, and and I learned a lot from her. And it wasn't necessarily pediatrics; it was more so how to talk to patients, how to talk to parents. Um, as a mother, she would say, "Hey, give me a spiel of what you say to a parent," and I would tell her just kind of the rundown of how I would greet them and how I would talk to them about care, what I recommend treatment wise. And then what my problem early was, I gave too many options. She was like, "Look, as a mom, that's too many options. That's just this or this." And that kind of feedback really helped me with case acceptance. My case acceptance went way higher, because you're giving people are coming to you with a problem, or coming to you not knowing they have a problem, and you're the one to tell them. And they don't know as to what the options there are. And limiting the options based on what you feel is the best, versus the options that all the options that are possible, can really help with case acceptance. So mentorship is huge. It's really important. Another aspect when applying or accepting jobs are benefits, compensation. Would you be a 1099 or W-2? If you've had a job before, you may know what that means. But basically, if you're an employee in that facility, maybe a W-2, the money that you get in your bank account is after taxes. Is basically 1099 is that you will own your own company. So that office doesn't necessarily hire Dr. Christopher Chance. They hire Dr. Christopher Chance PLLC. So the money that you receive is pre-tax. So you have to make sure you save money for your taxes. But that kind of changes how you kind of navigate your money. If you own your own business as a 1099, you can write some things off, just things like that. I would talk to a CPA. I don't really know the specifics, but that's also something to keep in mind. Collections or production. Working at a corporate office, they expect really high percentage of collections, which means if I plan on doing a crown on a child and the crown costs $300, then, and let's just say, for all intents and purposes, 100% of that crown, $300, is being paid by the insurance. Or let's just say 200 is by the insurance and 100 is by the parent. Let's just say that. They are expecting to collect basically all of it. They have systems in place, people to make sure they get their money. And so they're expecting to get basically 100% of that money. They're expecting to get the 200 from the insurance and the 100 from the parent. So I was paid on production. So basically, I was paid based on what I did and what they were expecting to come in. Collections maybe is a little bit different, because it's based on the money that they actually have, like they were actually able to collect. So that's more so some things that I would see in an actual dental office owned by a dentist, because, sometimes some dentists and some offices may not have 100% collection rate. They may not get 100% of the money that they expect, for whatever reason. So they'll just kind of pay you on what is received. So, take that into account, because if it's not in the bank account, you may not get that portion until it becomes in the bank account. Your commute, be honest with yourself. My commute initially was about 30 minutes, 30, 40 minutes. And that was fine for me. If I wouldn't apply to any place you can't consistently get there, especially if you're required to be on call. Restricted covenant, basically, if you own an office, if you work at an office as an associate, there's a basically a limit distance-wise of where else you can open. So I worked 40 minutes away. My restricted covenant was I couldn't work anywhere within 5 miles of the office that I worked in. Be careful with that, because if you work for someone who has multiple offices, make sure, try to see if you can get it with just that office, not a distance between every office. And then sometimes you may end up getting locked out of a city, but it's usually not enforceable at that point. I would recommend getting a dental lawyer to read a contract. Don't necessarily rely on you just reading it. There's a lot of things that they know that you can add or try to add, and some things that they know that they probably recommend you strike. And autonomy, can you work the way you want to? That's some of the factors that really guided me. Okay, so Oaks Point Pediatric Dentistry, this is my office. I started the process of opening this office in July of 2018, and then eventually signed the lease for the building on February 2nd of 19. Now, there's a lot of groundwork that goes into trying to open an office, a lot of groundwork that goes into opening an office. And at a later date, we can talk a little bit more about that if you wanted to have a discussion on how to open an office and everything. Now, we began construction in April 2020, so right, when COVID started. And so, navigating through that was a challenge, but, we're here and we are enjoying being in our neighborhood, and I couldn't ask for really anything better. So another picture of my office, the picture on the right is our lobby. I think for me, it was important to have a modern feel. And then also, being able to add different things in the future, like murals, add some color in different places, and having the office and having the neighborhood see the office grow was really important to me, because they can point out different things that weren't there the time they were there before. Okay, so typical day in the office as an associate. So kind of a little bit of a day in the life of my typical week. So I work as an associate on Mondays, and I work in an office that is a corporate office. It's kind of a hybrid. It's a corporate office, but the office itself is owned partially by the dentist. And so I kind of want to show you a little bit of the difference of what life is like working as an associate and then having some additional responsibilities as an owner. As an associate, you can kind of basically just arrive before the patient comes into the door, right? So everything is set up for you. The assistants already know what to do. It's been an established practice. There's less that I have to think about. I come in, I do the work, I help the kids, I make sure they have the best of time as they can, the parents, they have a great time as well. And the staff, I make sure that they're taken care of, and then I go home. So basically come in, close to where the patients come in, then treat patients, diagnose and decay, the pathology, clean patients' teeth, restore damaged teeth, remove them, or and maintain the space. Complete chart notes, lunch for an hour, repeat, and then go home, and I leave dentistry behind. As an associate, they deal with the business. They deal with the staff and the payroll and everything like that. I just come in, I do my work, and I go home. So that's definitely appealing. It was exciting to me because I don't have to bring dentistry home with me. Working as an owner is very different. So currently I'm open at my office Tuesdays, Wednesdays, and Saturdays until we grow a little bit more, then we grow days there. I typically now, months from now, years from now, this is not going to be the same because, systems and individuals will be in place, more individuals be in place to make my life more like an associate, even as an owner, because I delegate duties. But right now, I typically come to the office early before it's open, because I'm very picky on the experience I want my parents and my patients and my staff to have. So I want to make sure everything's clean and make sure everything is working, the technology is working. And I kind of try to make things as I guess basically how I would want to come into an office. I want to be blown away. Like I want to have a great experience. I want to, come in one time and say, okay, I don't know what happens here, or what happens in the future, but I'm never leaving here. And so yeah, so that includes coming early. I have my lunch. I can set my hours, so I set my lunch to an hour and a half. Nothing more than I just like having longer lunches, and I can do that. So um, that at some point I might make them 2 hours. I'm not sure. It just kind of depends how I'm feeling. But I like giving opportunity to have a longer lunch to kind of feel relaxed and kind of recharge. And during that time, for me, it's not just eating lunch. So I'm talking to other offices, going to other offices, dropping off marketing. Marketing materials, running errands for the office, things like that. So it's a lot more on my plate. After completing chart notes, I call the parents, check on the patients that had treatment. I like having that personal feel and make sure everything's sent to the insurance correctly. Post payments to the charge, take check to the bank, then go home, and I'm on call for emergencies. So it's a little bit more responsibility. Actually, a lot more responsibility. But that's what I know. What I always wanted, and the stressful days, it's a different type of stress, but it's going down more and more every month that we're here. It's going to be exciting to see what's going to happen in the future. Now, this is a typical day at the office at Houston Children's Dental Center, which is the surgery center that I work in on Thursdays and Fridays. Now, basically, the surgery center is for kids who are either too young to have treatment done in the general office setting, or that basically the decay is too great to for having a child kind of forcefully have treatment done in a dental setting. It's typically safer to do it in a surgery setting. And then sometimes for individuals who may have special needs or other health concerns that other dentists may seem to be a little bit more, at times, higher risk in a dental setting. So I arrived there at 6:45, excuse me, in the morning. Give parents informed consent and talk to the parents about what to expect, and then see a first patient by 7 in the OR. Do complete full dental rehabilitation under general anesthesia. Try to finish the case within that hour, and then greet the next patient, and then do exams for the patients who were to come potentially a week, 2 weeks after. And then we just kind of repeat the process, roughly about 8 to 10 patients a day. And this is kind of a similar setting as the associateship, is that, I don't deal with any of the business aspect of this particular facility. So it's just basically I'm an associate at a surgery center. So again, I leave the dentistry behind and I go home. Now, usually on the days that I'm working as an associate, I also stop by the office at night just to make sure everything is okay, and checking if I had any packages or any phone calls and call patients back. So the office does take quite a bit of my time until we get to the point where a lot of this will be automated. Now, a little bit more about working at an outpatient surgery center. Treating children under general anesthesia is something that we started doing while in residency. It's a part of our residency where, for that same reason that I mentioned before, in certain aspects, it's very difficult for some children to have their treatment done in office. I'm going to show you a couple pictures here in a little bit that kind of outlines a little bit of the type of treatment that we do and the type of decay that we're seeing that warrants treatment under general anesthesia. What's really helpful with that is that while in residency, doing treatment under general anesthesia, we were pretty heavy in that at Case Western because of how many kids there are in the Cleveland area that needs this type of care. There's a lot of kids with a lot of decay, and we were pretty booked in regards to doing cases. I think in the 2 years, I believe each resident, and there are about at the time about 8 to 10 residents, each resident would have about 400 cases under the belt, but, of children that we've seen under general anesthesia. And so that it's an awesome opportunity to learn how to do the dentistry faster and be efficient, because you don't have to worry about the behavior management. And by not worrying about the behavior management, when I'm in an office setting, the last thing I think about is how to work, the handpiece. Last thing I think about is how to do the treatment that I'm going to do. It's more so how to manage the child and make sure that they're having an experience that isn't traumatizing while we do it. So a little bit of what I was talking about in regards to the outpatient surgery center. The picture on the top is a child, and these are all pictures of children, likely 4-year-olds or less. They're very young, having decay this fast. And the youngest that we see at the outpatient surgery center is a year and a half, just based on age, because of safety mainly. But yeah, I mean, we see kids that young. And the patient on the picture on the top, I removed, there's 10 baby teeth from the top arch, and there's 10 baby teeth from the bottom arch. Out of the 20 teeth that he had, I believe I removed 12 of them. It was 8 on top and 4 on the bottom. And that was a child that I believe was 2 years old. And the pictures on the bottom was a child that was, I believe, 3. And we were able to save the teeth in the front. And he had some cavities and did some crowns in the back. But this is kind of an illustration of some of the decay that we can see, that some of these kids are getting this fast. And some people would say, okay, you're working on children's teeth. A lot of parents think they're just baby teeth. They're just going to fall out. However, these teeth that you're seeing right here, the front 4, let's talk about the front 4. These teeth typically don't fall out until about 6 to 8 years old, roughly about 6 for the 2 central incisors, and roughly 7 to 8 or so for the laterals. And so when you have them removed by 2 years old, it's quite a while without teeth. And sometimes, in regards to education part of it, a big part of pediatric dentistry is education. It's understanding that, there's only roughly about 8,000 of us pediatric dentists in the country. And for the millions of children there are, there's a lot of children who are not seeing a specialist in pediatric dentistry. Now, you don't have to be a specialist to see children, but, learning, if you're a general dentist or if you're any other type of, specialty, learning pediatrics is going to be very, very important, because you have to know where you start and understand that the education is going to be very important as well. And so, the big part of treating these caries is making sure that a lot of these children have siblings, and siblings younger than them as well. And so if a parent knows better, they tend to do better. And that's the biggest reward that I have is understanding that even after a child may go through this, understanding and seeing the parent make that change. Because there are times where parents will tell me, thank you for not judging me. And that's a big part of that is, I feel bad already. I didn't know that you could get cavities this way. I didn't know that, giving them a bottle while sleeping was going to do this. I just wanted them to be happy. They were crying. I wanted them to stop. I have another child that's also younger than them. So I was dealing with them, and I, somewhat neglected this child. And on top of that, one thing that we do as pediatric dentists, and hopefully do, is to help guide to the right direction and not necessarily condemn them to, for what happened in the past. I always tell parents, you came to me, you came to us, that means you're a good parent. It's not necessarily that because of the past, you can't change what happened before. You came to us to make a difference and to get something fixed. So you're doing what's best for your child at this moment. So basically, with the teeth on the bottom, what we did where the decay entered the nerve. So we ended up doing a pulpectomy where I removed the existing nerves and then put root canal material in there and then place these zirconia crowns on the teeth. Now the gums, when doing the white crowns, tend to get sometimes chewed up a little bit, only because the white crowns are a lot thicker than the silver crowns, and nowadays aesthetics are important. So we want to try to avoid using silver crowns if we can, but we have to take more tooth structure away in order to make the teeth not look like chiclets and kind of look a little bit closer to what they naturally are supposed to look like. The gums tend to heal up pretty quick. The mouth is one of the fastest healing parts of the body, kind of next to the eye, and so that tended to heal up pretty quick. Let's see. And another aspect of pediatric dentistry is not necessarily about cavities. Those are absolutely preventative. But what happens when you see something that you could absolutely not, not prevent or never expect? So this child, I saw her, and I will never forget it. It was probably the last month of residency, and she came in. She was 10 years old. She came in as a referral from another office, and the referral basically said, well, she had a tooth on her bottom right. Well, if you're looking at the X-ray or looking at the panel, it'll be on the left side, that was loose, and the area behind that tooth hurt when she bit down. And so when she came in, the other office didn't necessarily take a pan. They just thought, we'll just send them over to the pediatric dentist, which is another aspect of the education, that even if you're a general dentist, you should know a little bit about pediatrics, so we can, at least when they come to us, we have a little bit more guidance on what to do. But I ended up telling our staff to take a pano to see what's going on, because it is something I hadn't seen before. I mean, I've only been a pediatric dental resident for about a year and some change. So I wanted to see what was underneath, and there was a huge growth, donogenic tumor that was forming in that area. And so we immediately, she didn't leave the hospital until much later in the evening. She stayed. I had her admitted, and she was seen by an oral surgeon resident, or a maxillofacial surgeon resident. They came in, they evaluated her, and soon after she went into surgery, and they removed, I believe it was likely that it was a mieloblastoma. They removed the tumor aspect. And so, as you can see, her bone is very, very thin at the bottom, at the base. So it's likely that she would have her right side of her jaw resected, removed, and then basically have a prosthetic area where it kind of mimics the right side of her jaw. Now, during the time of that, all the rest of the surgery aspect, I had left residency, but left them in great hands in regards to the oromaxillofacial surgeons at Case Western. So these are some things that can happen that, are completely out of our control, something that we cannot at all predict or prevent. But it was a situation that came to us in the pediatric setting, and we were able to figure out what's going on and help her. And so pediatric dentistry to me is, I'd say I use it, it's a vehicle. It's a vehicle to help change lives. It's a vehicle to really help children to take ownership in who they are, ownership in their health. And one of the best parts about my job is I can turn something that's seemingly scary, like going to the dentist, and make it not scary. And so I use that, and I tell the parents, I have the parents come into the room. I don't separate parent and child. And because I want them to see the growth their child is having and foster that at home. So you can tell a parent, show a parent and the child of how powerful they can actually be by turning something scary and making it not scary. I say, well, you can't come to me and tell me you're scared about, trying out for the football team, or you're scared about, how you're going to do on this test, or you're scared about this, because I'm going to draw back from what I know you can do. And I tell them, I said, look, nobody's putting any sharp instrument in your mouth. Nobody is doing drilling in your mouth or anything like that. You did that and you did an amazing job with that. So what else can you do that you thought was scary at first, but now you turn that into power? And so, yeah, I mean, I think as you can tell, I love what I do. There's not a day goes by that I feel like I'm actually at work. And I hope that, you all can look at all the different aspects of dentistry that you're listening to with the other presenters and everything like that. And you have some phenomenal individuals come and talk to you. But I really hope that you take pediatric dentistry and you give it a chance. And when you enter dental school, if you are not, or you yet to go into dental school, or if you're currently in dental school, to really look around and kind of take in the moment and see what you actually love about dentistry. Find what you love and do that and be really good at that. I found that working on adult teeth was not my ministry. It's not what I'm good at. There's too many options. Like there's so many things you can do in an adult tooth. You can put a filling on it, crown it, inlay, onlay, veneer, partial. No, look, a baby tooth, you're ever gonna watch it, smooth it off, fill it, crown it, take it out, put a root canal. That's it. Like that's all we do with baby teeth. So the biggest thing is the impact that we can make on these kids. So thank you so much for your time. I really appreciate each and every one of you for listening to a pediatric dentist just talking, just ramblings, which is what we do. We just ramble. And look forward to talking to you in the future. Thank you so much.
Awesome. Thank you so much, Dr. Chance. This was a really informative session, especially on the aspect of, the corporate aspect of dentistry that a lot of people tend to kind of forget that it actually exists. So thank you so much. Let's go ahead and we can get started with some of the questions that we received. And the first one is, what score did you get on the DAT and what was the study schedule like?
Wow. Okay. Yes. I really haven't thought about that in so long. I believe I got a 21. No, that was in perceptibility. I think I got a 20. It was either 23 or 21. It was one of those two, if I can remember correctly. But okay, that schedule, I did a few things. So I did the Kaplan course. And I really just set aside my time every day. I studied for 2 months straight. I'm not really good at studying for a long period of time. Like I can't take a whole semester and study for a test like that in between all the other things I'm studying for. So for me, I would just take a block and just dedicate my whole just basically life to that. So I would come in, I remember that summer, I would wake up about 8:00. I would, breakfast, maybe work out or something, and go to the library for probably about 4 to 5 hours or so. Take a break, like a longer break, like a whole hour or two or so. Maybe visit some friends or something like that, and then go back and then go till maybe about 5 or 6 or so, and eat dinner, and then just kind of relax and let all that information that I went through kind of settle. I think the biggest thing was I didn't want to overstudy, because sometimes when I have too much information, I can second guess myself because some things sound like other things, and it kind of gets jumbled in my brain. So I just really hunkered down for probably about 2 months or so, and did it all that way.
Awesome.
I'll have to look that score up. I could be completely wrong. So, but I'm gonna look it up and I'll get back to you. But I think it was like a 20.
Cool. So the next question is essentially knowing how the content in dental school is very heavy and you have so little time with so much information. So like, especially during the first year of dental school, how were you able to switch from like undergrad to dental school?
Yeah. I think one thing that kind of helped me was throughout, well, because I went to undergrad and dental school in the same place. So that helped me a little bit because I already had friends and I already knew the landscape and everything. So I didn't do things too differently in the sense of I always keep my friends, like they know what I'm in school to do. And that's why they're my friends, because they know that I can't go to everything they go to, and they know why. And so I think the biggest thing is having people around you who respect what you're doing. And they won't try to pull you away from things that you're supposed to be doing, because sometimes it's hard. You want to just go off and have fun and everything like that. But I think it's all a balance. It's all a balance. I think life now with COVID and everything online. I can't necessarily attest to what it would be like online, but I loved the grind part of it. Like I just kind of fell in love with the studying, which sounds kind of weird, but um, when like I was saying before, like my first introduction to like actual dental work was with dental students. And so I think that was really good for me because I got to ask them and they got to vent about how hard that everything was. And I was like, wow, that sounds cool. That sounds hard, but it sounds cool. And so I would just say, just kind of be present. There's not a reason that they're teaching you something that doesn't mean anything. Um, but yeah, I just say, stay focused, keep people around you who know what you're doing and respect what you're doing, and take it every day by day. You're gonna have your ups, you're gonna have your downs. Like I said, I thought I failed the boards. There's so many tests that I thought I failed. So many things I made mistakes on. But it doesn't matter if you're to the last 25% of your class, or your first 25% of your class. You're still gonna be called doctor on graduation day. So um, keep that in perspective.
Awesome. And then our next question is, what are your thoughts on the new formatting of the board's examinations, how they're only like one part right now rather than two parts like recently?
Okay, so being only one part now, I it has a little bit of its benefits and drawbacks. So for being two parts, you kind of can compartmentalize this information on part one, this information is on part two. But have everything at once. I think the information is way more broad, so it can be a lot more difficult in that sense. But I kind of equate that a little bit about doing the boards in pediatrics, is that, you know, there's so much that we have to learn, and it kind of is going to require you to go back and study from what you learned in the past. When I knew I was studying for part two, there's certain things from part one, early part of dental career, that I was like, okay, I know that's not on the test, so I'm not going to worry about it. But later on in practice, you're like, wow, there's so much information that I actually use that I just kind of blocked out. So I think it's going to be, I'm not going to say it's, without having to go through it, without having to kind of study for it, and be right there in the mix. I can't really attest to how I completely feel about it, but it's just going to be something that we're going to have to navigate through in regards to studying for a broader amount of information. So.
Awesome. And then we'll go ahead and take one last question, and that is, when is a good time to decide to specialize during dental school?
It sounds weird, but as early as you can. And that's only because there are individuals, and I'll be honest, individuals like myself who came into dental school knowing what they wanted to do. And there's no rush. I will say, I don't want to have you go in there and rush and say, oh, I want to do this, I don't want to do this. But dental school is, a lot of it's what you make of it. If you have any time extra, if you have, not necessarily between a class, but if you ever wanted to talk, the professors are there. Like, so I liked ortho, which is why ultimately I ended up with pediatrics, because I get to do ortho and pedo. But if I wasn't a pediatric dentist, I'd be an orthodontist. So I was really, really cool with or the orthodontic professors in Kentucky and at Case because I liked it so much and I liked them so much. But that didn't require anything of me to talk to those people. You know what I mean? So I would say talk to everyone, get to know everyone, professor wise, ask them questions. Um, because we get these things are getting more and more competitive. It was competitive when I went through. And so until they create more spaces, more facilities, which I believe they're trying to do, but you know, the earlier you can kind of narrow things down, the better, because you're able to now go into focus, excuse me, on experiences having to do with that. So if I want to do pediatrics, I know I want to do pediatrics by year 2, then I know that they're doing Give Kids a Smile in February. Like, so I know I want to do that. Or I know they're doing a remote area mission trip somewhere. They're working on kids or working on adults, doing oral surgery there. Oh, I know that that's on my radar. So I'm gonna go to that. So the earlier you kind of narrow things down, the more experiences you'll expose yourself to because you're already thinking about that.
Awesome. Thank you so much, Dr. Chance, for today's session and for answering all of our questions. We're so happy that you were presenting with us today, and we look forward to hearing great things about you.
Absolutely. It was my pleasure. Thank you so much. Let me know anytime you ever want to talk about something in particular or anything else in the future. So y'all are awesome. You're phenomenal. Keep doing what you're doing. Contact me if you want to. I think I have some information there as well. But thank you again. You're awesome.